Hi guys, welcome again to another episode of Easy IVF. Past videos I've been making has actually focused on the treatment of infertility or the treatment of some sort of fertility. I've also focused on fertility preservation, but what actually causes infertility? Today's video would focus on the causes of infertility in women. I hope you enjoyed this video. Stay tuned. Infertility is defined as the inability to conceive after 12 months of regular unprotected sexual intercourse. After a year, then it may be the right time to go to the hospital to find out what's actually going on. Infertility comes in different shapes and forms. There is, subfertility and also there's absolute infertility. Absolute infertility is when there is full tubal blockage that would prevent the interaction of the sperm and egg, or when the ovaries has been taken out following a surgery, or the uterus has been taken out and all of that stuff. That's absolute infertility. So under normal circumstances, obviously, a woman would have a normal menstrual cycle and then an ovulation. And if you have an unobstructed fallopian tube and a very receptive endometrium for implantation, then the egg coming together with the sperm of a normal male partner, that could lead to fertilization, implantation, and pregnancy. Any alteration in this basic normal or hormonal functions in the female reproductive system can lead to infertility or subfertility. So let's just go down to the causes of infertility. The first one we're going to talk about today is tubal and uterine abnormalities or blockages. So if you have any tubal damage or tubal injury or tubal obstruction that could be caused due to genital urinary tract infection, such as chlamydia, that would cause, obviously, an inflammation, and an inflammation will cause the narrowing of your tubes, and that will cause a damage and possibly an obstruction. And when that happens, the sperm is not able to mix with the egg, and that brings you to subfertility or infertility. Things like tubal damage by endometriosis tissues can also, depending on the stage of endometriosis, you can also have tubal adhesions due to previous surgeries around the uterus. Say, for example, you had a uterine fibroid removed, right? And after the surgery, it healed up fine, but down in there, it causes an adhesion. So two of the tissues comes together and they clamp together, and that's an adhesion. With that adhesion, you would see that there is no thorough way for sperm cells to pass to get into the fallopian tubes and to get the eggs. That would hinder you from being able to conceive. And also, if you've had previous tubal pregnancies, say if you had ectopic pregnancies in the past, that can also lead to obviously scarring, and scarring can now cause adhesions and obstruction. Luckily enough, some people might be able to use the other unaffected side to be able to have kids, but when it's bilateral, when it's on both sides, that can also cause infertility. Yeah, so still on the uterus, some of the other things that can cause tubal obstruction or abnormalities are things like having fibroid. The fibroid you have is very close to your endometrium, and that will cause the endometrial structure to be disrupted, right? And it might also have a negative impact on the implantation. So let's say an embryo was to implant at the site of the fibroid, obviously that implantation would fail because it's obstructed by a malignant tissue. Just so you know, not all the fibroid that you'd have would cause disruption in the uterus, and not all the fibroid you have will cause infertility. That being said, if the fibroid is big enough, it can cause a physical obstruction in your uterus, and that can hinder you from getting pregnant. The second cause of infertility is endometriosis. So endometriosis is the presence, or say the proliferation of endometrial tissue outside the uterine cavity. It can range from minimal to severe forms of endometriosis. So depending on the form of endometriosis that you have, that can actually affect your fertility, especially when you have severe endometriosis. So endometriotic adhesions can now disrupt the tubes that you have, the patent tubes that you have, and also the ovarian anatomy. So what that does is that it prevents the pickup of oocytes by the fimbriae, and when that happens, the oocyte is not recruited into the fallopian tube, and that's not able, and the sperm cannot get to them. Sometimes as well, endometrial cysts can be present in the ovaries, and that would disrupt the oocytes from being released. And when the oocytes are not released, there can be fertilization. So when you have minimal to mild or moderate endometriosis, there is really no clear explanation as to how they cause infertility. When you have a severe form of endometriosis, it's always good to get in touch with your physician if you're planning to have a child, for them to assist you in the best medical way possible. Condition where a woman's vagina squeezes and goes into spasm when something is about to enter into the vagina. And you say, for example, even things like tampon can cause the vagina to squeeze and be in a spasm. So, and even when you try to put in a penis into the vagina, that causes spasm. And so if that has happened, it means that you are experiencing a psychological sort of infertility, because there is no penetration, and obviously when there is no penetration, there will be no fertilization of an egg, right? So because anything that goes through the vagina causes that spasm. Even if you were to do intrauterine insemination, you would still get the spasm when you had the catheter passed into through your vagina. One of the main causes of infertility is actually problems with ovulation. Now we know that the female reproductive system works with the anterior pituitary gland, and those are responsible for the secretion of, obviously, the luteinizing hormone and the follicle stimulating hormones that helps the follicles to grow, that helps in that helps to trigger ovulation, and that helps to prepare the uterus for receiving that oocyte. So when there is any problem with, when there's any interference in the reproductive hormones that stems from the disruption of the anterior pituitary glands, that can cause an imbalance in the levels of luteinizing hormone and follicle stimulating hormones. And once that happens, there will be obviously a problem. Conditions like polycystic ovarian syndrome, where there has been irregular menses for over 6 weeks. There is polycystic ovarian morphology in ultrasound that shows that one ovary contains at least more than 12 antral follicles, and they are enlarged over 10 mils. In cases where there is excess body hair or raised serum androgens, those can cause infertility. Still on ovulation and things related to the ovaries, when there is ovarian failure or premature failure that occurs early in life, can lead to infertility. If your ovaries fail to function, say at the age of 35, at that point you're infertile because your ovary has failed, and they kind of exhibit themselves in forms of menopause, right? It's like very, very early menopause. Premature ovarian failure can also arise due to chemotherapy following the diagnosis of cancer, or radiotherapy, and at times genetic factor like Turner syndrome can also play a factor in that. So if you've watched my video on egg preservation or embryo cryopreservation, this is one of the reasons why you should freeze your embryo or your eggs in time. I'll put in a link above, or a link at the end of this video, where you can watch a video on how and why you should freeze your eggs or your embryos before chemotherapy. So premature ovarian failure can arise from just the exposure of chemotherapy, and at times it's just there's just no reason to explain why someone who hasn't undergone such treatment would have premature ovarian failure. If you are on psychotic drugs or medications, some of those medications can raise your prolactin levels, and when that happens, that will reduce the gonadotropin releasing hormone, and that drives the pituitary, and that obviously would affect your levels of luteinizing hormone and follicle stimulating hormone, and that would consequently have an effect on your ability to be fertile. One other main cause of infertility is advanced maternal age. So age, as women age, the quality of their eggs decline. There is an increase in the number of aneuploid oocytes, meaning that the number of chromosomes in the eggs is either lower than 46 or higher than 46, right? When such egg is fertilized, the embryo is less likely to implant, and that's less likely to lead to pregnancy. And even when it implants, it's less likely to lead to. That's because the embryo does not have a complete set of chromosomes. Things like trisomy 21, Down syndrome, however, can pull through at times. They can have that excess chromosome and still be able to implant and carry on to a full-term pregnancy. So the age of a woman would affect the quality of her eggs, and the quality of the eggs can reduce her chances of getting pregnant, and that can lead to subfertility and maybe infertility. And this is more reason why I always say freeze your eggs now and use them later. The last but not the least is at times we just don't know what causes your infertility. There are just unexplained causes of infertility, and aside from anatomical and hormonal causes of infertility, there are also molecular causes of infertility that cannot be diagnosed during your routine fertility checkup. Let's say you have a molecular defective sperm that lacks an enzyme that is responsible for the activation of the eggs, right? So a standard semen analysis cannot actually tell you that you lack those enzymes or those molecular components that is responsible for the activation of the egg. So even if you were to do a normal IVF and ICSI, you might still not have fertilization following that. So you go in for an IVF and you have complete fertilization failure or fertilization rate less than 5%, or you go in for an ICSI and you have fertilization rate less than 5% as well. That might give the medical practitioners or that might sense that there is something wrong in the molecular level, and in this case is very unexplained. Just to make sure that you consult with your doctors and know that there are so many options out there for you to be able to get through this. Infertility, there is a stigma that is associated with infertility, but with the recent development in the medical practices and medical interventions, you can beat that. Thank you so much for watching, and cherish life.